We have an addiction medicine clinic, and this year in 2024 is the 55th annual meeting of the American Society of Addiction Medicine. So there's 55 years of research, and with this opioid crisis, so much more. So we have learned so much about what we call the neurobiology of addiction. So we wanted to explain what these addicts are experiencing. So these medicines, which are narcotics and pain pills, are very effective if people have pain, and they're very safe. The New England Journal of Medicine, the highest level of evidence, the chances of getting addicted if you have pain and it's prescribed in a medical setting is 1 in hundreds of thousands, and that hasn't changed. So these are very effective medicines, and they need to be continued to be used. But if the brain is exposed to these medicines when there's not pain, that's when these cellular changes happen. The most common stories of when people become addicted, they've developed some type of injury and went to a doctor and got their pain pills, appropriately. But then medical care was inappropriate, and people were, didn't get testing or specialty care, or they were continued on medicines for longer than they should be. And then when the brain is exposed to narcotics, when there is no pain, there's 3 areas of the brain that develop cellular changes that they think is permanent. So one of these is the limbic system, and that's the portion of your brain that helps you experience, pleasure with, intimacy, very intense desires. So the pleasure centers of the brain are affected cellularly and permanently. And then what usually keeps people from making bad decisions is the prefrontal cortex, and that's like your decision center, and it helps you kind of control behavior. So we have, this desire for inappropriate behavior. We have an inability to stop behavior and control our actions. And then the third area is called the extended dopaminergic pathway, which has to do with communication. So there's great communication between the areas of the brain that inappropriately want to have pleasure sources and desires, inappropriate ability to control it with the prefrontal cortex. And since these are felt to be permanent, then once people are on treatment, they're probably going to be able to need to stay on them really indefinitely. So addicts are really kind of judged, and they're, live terrible lives, and, people treat them poorly with their family and their friends because they often have relapses, and it's difficult. We have many people that initiate their treatment. They're, kind of in poverty, spending way too much money for drugs on the streets. Many times their relationships are a mess, or don't have their kids. But there's these medicines that are very effective. So it's called medication-assisted treatment. And the medicine is buprenorphine, and that's prescribed as either Subutex or Suboxone. And when the brain sees these medicines, the receptors are filled. MRIs show the structure of the brain. There's a different type of test called a PET scan, which is positron emission tomography. And that shows the biochemistry of the brain. And we can see the narcotic receptors. And when people are on the buprenorphine, all of these receptors are full if they take 2 of the 8-milligram pills a day. And then once the receptors are filled, everybody says the same thing: I feel normal. So people are not getting high, they're not getting relapse, they're not getting withdrawal. When they're on their medicine, the receptors are full, they don't have any desires, they literally never even think about using, and they can maintain normal, healthy lives. So the first thing that changes when they're in treatment is their finances improve, because the cost of the program and the medicine is less than most people are spending on the streets to get them illegally. And then once people don't have to lie, about their condition anymore, then the relationships start improving. So we have people get the relationships back, get their kids back, they start businesses, they hire employees. And so these medicines can really change people's lives, but they need to be aware that it's a long-term condition. So because these changes are in the brain is why addicts get judged. But it's really no different than people that have cellular changes, in their kidneys or intestines or asthma. So any chronic medical condition is based on cellular changes of some certain organ. And people aren't judged if they have hypertension or diabetes or asthma. But if it's the brain changes, that's why there's this societal pressure that they should be able to have better behavior. But because of the understanding of the neurobiology of addiction that we have through the 55 years of research, we understand what these people are struggling with, and we have very effective treatments to allow them to live normal, healthy lives.